In previous lecture, we started new unit in pharmacology and toxicology is drugs affecting on the renal function in which diuretic. In diuretic, we discuss definition of diuretic, then physiology means formation of urine occurs in the nephron in 3 stages. After that, classification. Diuretic mainly classify into 8 classes. So firstly, definition. Diuretics are the pharmacological agents or the substance they promote diuresis process and also increases diuresis process as well as excretion is known as diuretic. Then formation of urine. It is occur in the nephron in 3 stages. Nephron, it is structural and functional unit of renal system or urinary system. So 3 stages: active sodium reabsorption, then exchange of sodium and hydrogen ion and exchange in between potassium and sodium ion. After that, we discuss classification. So it is mainly classified into 8 classes, subclasses, in which we discuss first 4 classes, their mechanism of action, how they act on the particular site in the urinary system or in renal function, and how they act as diuretic, in which we discuss this chart, in which particular diuretic, their site of action and mechanism of action. By different mechanism of action, this agent shows same pharmacological action. Then remaining 4 classes from thiazide diuretics we are going to discuss in today's lecture. What do you understand about osmotic diuretic? What are the examples?
Mannitol, glycerol.
Mannitol, glycerol. Yes.
Okay, how they act and shows diuretic effect. Screen is visible?
Yes, ma'am.
Yes, ma'am.
Yes.
They reduce the absorption of sodium.
Okay, means they act on first step of formation of urine, that is diuresis. So they reduces active reabsorption of sodium, and that's why there is need loss of water and electrolyte, and which enhance the diuresis process. Then second class, their preparation. Read the preparations, anyone? Read the preparations of osmotic diuretic.
Mannitol ampoules, 25% solution in 50 ml. Isosorbide, 50% solution, 1 to 2 gram per kg body weight, as 50% solution, and glycerol, 120 gram per day orally.
Okay, so these are the preparations of osmotic diuretic, water and osmotic diuretic. Their example: isosorbide, glycerol, mannitol, and urea. Then second class, xanthine diuretics. Which is most effective xanthine diuretic? Aminophylline and theophylline?
Theophylline.
How they act as a diuretic? By which mechanism? First sentence.
Increasing renal blood flow with reducing reabsorption of sodium.
Okay, so xanthine diuretics act by increasing the RBF as well as inhibiting the tubular reabsorption of sodium, and that's why water and electrolytes are available for diuresis process, and this diuretics act as to increase the rate and flow of urine formation. Their examples are theophylline, aminophylline, in which theophylline it is most effective xanthine diuretic. Then their preparation, read the preparations.
Theophylline aminophylline by slow IV routes of in the dose 0.25 to 0.50 gram diluted in the 10 to 20 ml of 5% glucose solution.
So mainly there are two examples, xanthine diuretics, and their preparations are here. By slow IV route in the dose 0.25 to 0.50 gram diluted in 10 to 20 ml 5% glucose solution. Then next class, mercurial diuretics. So use of this mercurial diuretic is hazardous. Hazardous means
Correct.
okay. So that's why it is commonly used or rarely used.
Rarely used.
Rarely used.
Okay, what it causes? It is
Renal
hazardous.
impairment.
Renal
Rare
impairment.
implemented.
Okay. Examples of mercurial diuretic. Examples.
Mercelil,
Mercelil.
mercaptomeril.
And mercil. Then next is carbonic anhydrase inhibitor. Can anyone explain this mechanism? How it occurs? This is natural pathway. Normally it happens. Then how is carbonic anhydrase inhibitors act as a diuretic? What happens when they
Stop the
inhibit?
formation of carbonic acid.
Can anyone explain this whole pathway? Already it is discussed in previous lecture. 52.
Carbonic anhydrase inhibitors stop the conversion of carbon dioxide and hydrogen in carbonic acid. That's why there is no disintegration of carbonic acid in bicarbonate and free hydrogen ion. That's why no availability of free hydrogen ion, and also therefore no exchange of Na plus ion takes place, and also no reabsorption. That's why diuresis occurs.
Okay, so firstly, in the normal pathway, what happens? In this flow, you have to understand CO2 plus H2O in presence of carbonic anhydrase, which gives H2CO3. H2CO3 means
Carbonic acid.
carbonic acid.
Carbonic acid.
So this carbonic acid formation is occur after that it dissociated into the tubules. म्हणजे ते tubules मध्ये dissociate होतं. These are the renal tubules. Here there is formation of carbonic acid, and after that they dissociate, this carbonic acid dissociate into these tubules. या whole tubules मध्ये ते काय होतं? Dissociate होतं. When it dissociated, then it forms H plus and HCO3 minus. Here minus H plus and HCO3 minus. Then this H plus and HCO3 minus, it is exchanged with tubular sodium, and after that it causes reabsorption of equiosmotic volume of water. म्हणजे ते एक्सचेंज ऑकर होतं त्याच्यामध्ये H plus and HCO3 minus चे जे आयन आहेत and sodium याच्यामध्ये, and that leads to reabsorption. So in this normal pathway, this carbonic anhydrase inhibitor act as which agent? Sound is audible to all?
Yes, ma'am.
in this pathway, carbonic anhydrase inhibitor act as which agent? कोणता एजंट म्हणून ऍक्ट होतात कार्बोनिक अनहायड्रेज इनहिबिटर? क्वेश्चन समजलाय?
Diuretic.
So it is classification of diuretic. That's why they act as a diuretic on this pathway. So in presence of this inhibitor, it act on this stage CO2 plus H2O. So it inhibits this pathway. That is, there is no formation of carbonic acid, no availability of H plus and HCO3 minus, and there is no exchange, no reabsorption, and there is net loss of water and electrolyte. The next point, preparation. Read the preparation.
Acetazolamide, trade name Dimox, 0.25 gram tablet, 1 or 2 tablets.
Dimox, it is trade name. It is asked for MCQ. The next point, thiazide diuretic. So they are mainly act on PCT. What is mean by PCT?
Proximal convertible.
Okay, so thiazide diuretic are medium efficacy diuretic. They mainly act on PCT, proximal convoluted tubules, in which they inhibit the sodium and chloride symptom. Therefore, increases level of sodium in the lumen and also increases the sodium and water level in the lumen. मग सोडियमची आणि वॉटरची लेवल इन्क्रीज झाले, देन काय कशाचं फॉर्मेशन होईल? इट लीड्स टू which process?
Diuresis.
Diuresis process, that is total net loss of water and electrolyte. म्हणजे ते वॉटर आणि इलेक्ट्रोलाइट अवेलेबल झाले. कसं होतं? In which firstly there is inhibition of sodium and calcium symport. मग ते symport inhibit झाल्यानंतर lumen मध्ये सोडियमची लेवल इन्क्रीज होते as well as वॉटरची लेवल इन्क्रीज होते, and then which leads to urine formation. So by this way, this thiazide diuretic, they act as medium efficacy diuretic agent and promote the diuresis process. Then drawbacks, which drawbacks are observed?
Hypopotassiemia, hyperuricemia, aggravation of diabetes mellitus.
What is mean by hypopotassiemia? What is mean by hypopotassiemia, hyperuricemia? Hypo means
Less que low.
Less low.
so that is lower or less level of potassium ion in the blood. Then second, hyperuricemia. It is already discussed in drugs acting on blood system. What is mean by hyperuricemia? Mia means it is blood disorder. Hyper means
Increase.
Excess uric
uric
acid.
acid ची level blood मध्ये high level होते. That is high level of uric acid in the blood. It is termed as hyperuricemia. The next, aggravation of diabetes mellitus. Do you know diabetes mellitus?
Yes, ma'am.
What is mean by diabetes mellitus?
Increase the sugar level in the blood.
Okay. Do you know types? Any idea about types?
Insulin dependent diabetes mellitus and non-insulin dependent.
Speak loudly. 30 roll number. Types of diabetes mellitus.
Insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus.
Okay. So these are the drawbacks of thiazide diuretics. The next point, preparation. Read the preparations. Read the preparations of thiazide diuretic.
Drug chlorothiazide, trade name diuryl, dose 20 to 80 mg. आणि second hydrochlorothiazide, trade name hydrodiuryl, dose 20 to 40 mg.
Both the trade names are important for MCQ. Chlorothiazide trade name diuryl with their dose 20 to 80 mg. Then hydrochlorothiazide, it is also example of thiazide derivative. Then next class, loop or high ceiling diuretic. Roll number 52, read the slide.
It is potent oral or non-mercurial diuretic. On oral administration, it acts mainly on loop of Henle and prevent tubular reabsorption of sodium and chloride. Thus, administration of this agent result in net loss of water electrolyte, that's diuresis. Because of high potency, loop diuretics must be used QTSD as rapid reduction in extracellular fluid volume.
Okay, so firstly, this loop or high ceiling diuretic. Tell me the examples. Examples of this class.
Furosemide.
Furosemide. So it is potent and also oral diuretic, and also it is a non-mercurial diuretic. Oral diuretics are, that's why when on oral administration, it acts mainly on loops of Henle and prevent the active tubular reabsorption of sodium and chloride. Means the first step of diuresis जे आहे त्याच्यावरती हे ऍक्ट होतात. Location of loops of Henle. दिसतंय स्क्रीनवर. Site of loops of Henle.
Yes, ma'am.
Top ला की bottom ला?
Bottom.
Okay, so these high ceiling diuretics or the loop ceiling diuretic act here, and they on their oral administration they prevent the active tubular reabsorption. म्हणजे ट्यूब्यूल्स ह्या ज्या ट्यूब्स आहेत ट्यूबुलर सेल्स याच्यामधून सोडियमचं reabsorption prevent करतात, and this agent reduces tubular diffusion and reabsorption. Okay, so they prevent tubular reabsorption of sodium and chloride. Then thus administration of this agent result neat loss of water and electrolyte diuresis. ह्या administration मुळे ज्यावेळेस हे सोडियम आयन्स त्यांचं reabsorption prevent करतात, it leads to result in there is neat loss of water and electrolyte. वॉटरचा आणि इलेक्ट्रोलाइटचा लॉस होतो because of high potency. High ceiling diuretics having the high potency. Loop diuretic must be used occasionally as rapid reduction in extracellular fluid volume. म्हणजे हाय सिलिंग डायuretics आहेत यांची पोटेन्सी हाय असते. दॅट्स वाय हे विथ प्रिकॉशन यूज करायचे आहेत. दे यूज occasionally as rapid reduction in extracellular fluid volume. Extracellular fluid volume जे आहेत ते रिड्यूस करतात. That's why when they are used, they use with precautions. Then preparations. Which drugs act as high ceiling diuretic? Which drugs act as high ceiling diuretic?
Furosemide and
Furosemide.
And another example is visible in your screen.
Bumetanide.
Bumetanide.
Bumetanide. Their trade name?
Urine.
Burine.
Burine. Dose?
Urine. 20 to 40
20 to
mg.
40 mg.
Then second drug?
Furosemide,
Semide.
Their trade name?
Lasix.
Lasix.
20
Dose?
to 80 mg.
Okay, so mainly this loop diuretic, they act on the first stage of diuresis. Here they prevent, by their action on the loops of Henle, they prevent active tubular reabsorption of sodium and chloride ions, and also their administration leads to diuresis process, and these diuretics having the high potency, that's why they are given questionally as they cause rapid reduction of extracellular fluids. ज्या extracellular fluids आहेत त्यांचं रिडक्शन करतात, that's why they are taken with the precaution. Then they also leads to कार्डिओव्हॅस्क्युलर कोलॅप्स, म्हणजे हे हाय पोटेन्सीचे आहेत. जर याच्यामुळं हे कॉशनली मीन्स विथ प्रिकॉशन नाहीत घेतले, then it leads to, it results CVF collapse which is associated with hypokalemia. What is meant by hypokalemia?
पोटॅशियम लेवल डिक्रीज होते.
In
ब्लड.
it leads to hypokalemia and hypochloremic alkalosis. Hypochloremic alkalosis means there is base level is increases and hypochloremia in the blood, chloride level is decreased. So this is about 6th class in the diuretic loops or high ceiling diuretic. Then next, potassium sparing diuretic. Example,
Spironolactone.
spironolactone. And another example,
Triamethrin.
triamethrin. Potassium sparing diuretic in which aldosterone is a adrenal mineral corticoid. Adrenal gland. Can anyone tell the location of adrenal gland?
Upper side of kidney. Upper side of kidney.
So in this kidney, there are corticosteroids are the hormones. They are secreted in cortex part. Cortex part माहिती है?
Yes, ma'am.
Okay, so in the cortex, some hormones are secreted or steroids are present. They are known as corticoid. So aldosterone, it is an adrenal mineral corticoid which plays an important role in maintenance of electrolyte balance in the body. म्हणजे adrenal gland चा जो cortex part आहे त्याच्यामध्ये corticosteroid, mineral corticosteroid secrete केले जातात. Their example is aldosterone. So this aldosterone corticosteroid maintain electrolyte balance in the body. What is mean by electrolyte? Electrolytes, there is essential to in body or not?
Essential to
Essential.
body.
What is mean by electrolyte? Examples of electrolyte.
Na plus Cl minus K plus.
K plus.
Sodium, calcium, potassium, chloride, magnesium, phosphate. These are the electrolytes. So what is mean by electrolyte? काय आहेत ते electrolytes? चार्ज असतो का त्याच्यामध्ये? Positive, negative. Is there is charge on
Yes, ma'am.
electrolyte or not?
Yes, ma'am.
Yes, ma'am. Charge असतो.
Yes, ma'am.
What is mean by electrolyte? Why they are essential in our body? ओके, अल्डेस्टेरॉन काय समजले की किडनीच्या अबव जी काही ग्लँड आहे अड्रिनल ग्लँड त्याच्यामध्ये कॉर्टेक्स पार्ट मध्ये एक सिक्रिशन सिक्रिट केलं जातं दॅट इज नोन ॲज कॉर्टिकोस्टेरॉइड्स अँड this mineral corticosteroid secretion is aldosterone which plays important role in maintain the electrolyte balance in our body. It generally naturally all the process आपल्या सगळ्यांमध्ये होत असते. So tell me what is mean by electrolyte? Is it there is necessary to present electrolyte in our body? Yes or no?
Yes,
आहे का
ma'am.
गरज? Then why? Why there is necessary to presence of electrolyte in body?
Salt and water balance करण्यासाठी.
Osmotic pressure balance.
Salt and repeat again.
Water balance साठी.
52.
Osmotic pressure regulate करण्यासाठी. In the cells.
Okay, so electrolytes are sodium, potassium, phosphate, calcium, chlorides. They are present in our body with the charge, either some having positive or some having negative charge. So electrolytes the minerals आहेत. The electrolytes are the minerals in our body and they possess charge. And their need or why they are essential because they maintain amount of water in our body. Balance of amount of water in our body, it is maintained by this electrolyte. That's why they are essential in our body. Then potassium sparing diuretic, their example spironolactone are cheaply aldosterone antagonists. They antagonize tubular effect of aldosterone. Aldosterone का है first point?
Adrenaline mineral corticox.
ते कॉर्टेक्स जे ॲड्रिनल ग्लँडचा पार्ट आहे कॉर्टेक्स त्याच्यामध्ये सिक्रेट केलं जाणारं सिक्रिशन और स्टेरॉइड और हार्मोन आहे. सो त्याचा मेन रोल काय आहे टू मेंटेन द इलेक्ट्रोलाइट बॅलन्स इन द बॉडी. म्हणजे पोटॅशियम स्पायरिंग डायुरेटिक आहेत ते काय करतात दे ऍक्ट ॲज दे आर चिपली अल्डेस्टेरॉन अँटागोनिस्ट. म्हणजे त्या अल्डेस्टेरॉनचे ते अँटागोनिस्ट आहेत. अँटागोनिस्ट मीन्स
Stop the action of other drug.
म्हणजे त्याच्या ऑपोजिट आहे. Antagonize means opposite. Opposite or same?
Opposite.
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 Okay. So they काय करतात potassium sparing diuretic. They are chiefly aldosterone antagonists and they antagonize the tubular effect of aldosterone. व aldosteroneचा जो इफेक्ट आहे बॉडी मध्ये त्या इफेक्टला ते ऑपोजिट करतात, अँटागोनाइज करतात. Which agent? कोणते एजंट अँटागोनाइज करतात? Screen is visible.
Yes, ma'am.
Which
Yes,
agent,
ma'am.
which agent antagonize tubular effect of aldosterone?
Potassium.
Potassium sparing
Potassium
diuretic.
sparing diuretic.
The next one, preparations. First drug,
Spironolactone.
Spironolactic.
spironolactone. Trade name,
Aldactone.
Aldactone.
dose,
25 mg.
25 mg.
PID.
PID means BID.
Twice in a day.
Twice in day.
Remaining students, do you know what is meant by BID? एकही तेवढ्या कॉन्फिडन्सनी सांगत नाही की ऑलरेडी झालंय असं सांगताय तेही बरोबर आहे की चुकीचं आहे या वेळी. सुटिक्स मध्ये
Twice
झालंय का?
in day.
Yes,
ma'am.
Yes,
झाले.
ma'am.
हा, what is meant by BID?
Twice
Twice
in a
Twice
day.
in a day.
Twice in day.
Then second drug, triamterene. Triamterene, their trade name Diuretic. Dose
100 mg oral.
100 mg oral.
Okay, so these are the preparations of potassium sparing diuretic. Potassium sparing diuretics, they are in which aldosterone, it is an adrenal mineral corticoid. Corticoids are the steroidal hormones or steroids. They are present in the cortex of the adrenal gland, which plays important role to maintain the electrolyte balance in the body. Potassium sparing diuretics, they chiefly antagonize the aldosterone effect in the tubular cells, and which is leads to loss of sodium and वॉटर. मग त्याच्यामुळे काय होतं, जो ट्युबुलर इफेक्ट अँटागोनाइज करते हे पोटॅशियम स्पॅरिंग डायुरेटिक, विच लीड्स टू लीडिंग द सोडियम अँड वॉटर लॉस. सोडियमचा आणि वॉटरचा लॉस होतो युरिन मध्ये. and thus this agent protect the potassium ions, and that's why they act as potassium sparing diuretic. कोणत्या आयनचा लॉस होतोय? sodium ions and water. Sound is audible?
Yes,
Yes,
ma'am.
ma'am.
Yes,
Yes,
ma'am.
ma'am.
Loss of sodium and water in the urine, and thus this agent spear means protect. Potassium ion la protect करतात. That's why they are known as potassium sparing diuretics. The next class and last class, acidifying salts. Acidifying salts, like example of this class is
Ammonium
Ammonium
chloride.
chloride.
Ammonium chloride.
acidifying salts like ammonium chloride, when administered orally after absorption of ammonia, it is converted by the liver to urea, and during this process, free H plus ions are released. So in this process, so acidifying salts, their example is ammonium chloride. When they are administered orally after absorption of ammonia, it's converted by the liver to urea. During this process, free hydrogen ions are released. Means NH4Cl as a diuretic orally घेतलं जातं. After that, ते कशामध्ये convert होते? Converted by the liver into the urea. Then, and during the process, which ions released? कोणत्या
Yes.
Free hydrogen ion.
Okay.
Hydrogen ion.
Then there is next step is given NH4Cl, their conversion NH3 plus H plus Cl minus. Then the hydrogen ions is turns react with the bicarbonate and reduction in bicarbonate it changes. Their ratio is given HCO3 divided by HCO3. This causes acidosis. HCO3 means which acid?
Carbonic acid.
Carbonic acid.
कार्बोनिक ऍसिड
The hydrogen ions ज्यावेळेस बायकार्बोनेट बरोबर रिॲक्ट होतात तर काय फॉर्म होतं HCO3 and there is reduction in bicarbonate changes. मग रिडक्शन केलं बायकार्बोनेट मध्ये तर काय होणार आहे which changes the ratio. मग तो रेशो काय आहे HCO3 that is hydrogen ion and carbonic acid and here HBHCO3 CO3 आहे इथं. So this both the acid level ची लेवल इन्क्रीज झाल्यावर काय होतं acidosis.
Acidosis.
Okay, so this
Acidosis.
leads to acidosis means
Increase acid level.
okay. So these both are acid level. There is reduction in bicarbonate which changes the ratio is given HCO3 and BHCO3 means bicarbonate HCO3 carbonic acid and hydrogen ion carbonic acid. So due to this ratio, this causes acidosis means increase in carbonic acid level or increase the acid level that is acidosis. And this acidosis leads to fall in intracellular pH of tubular cell. जे tubular cells आहेत त्यांचं pH fall होतो. Fall means rise or increase or decrease.
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 डिक्रीज
Due to acidosis which leads to fall in intracellular pH of tubular cell and this causes diuresis. Then ammonium chloride has nauseating taste and causes gastric irritation. Nausea, gastric irritation, माहिती आहे?
Yes,
Yes,
ma'am.
yes, ma'am.
Ammonium chloride, a nauseating taste and also which leads to there is irritation to the GIT tract, gastrointestinal tract. That's why as better agents are available, these agents are rarely used. But other जे better agents आहेत ते यूज केले जातात आणि जो अमोनियम क्लोराइड ऍज अ डायुरेटिक म्हणून रेअरली यूज केला जातो कमी प्रमाणात. त्याच्या नावातच आहे ऍसिडिफाईंग साल्ट्स म्हणजे जरी त्याचं कन्व्हर्जन झालं आफ्टर दॅट which combines with the HCO3 हा रेशो this leads to acidosis. मग acidosis झाल्यावर काय होतंय what happened
Fall
Acid
in
level
pH of
increase होते.
intracellular.
acidosis it leads to there is fall in intracellular pH of the tubular cells. म्हणजे हा जो फ्लो आहे हा फ्लो मधला इंट्रासेल्युलर जो पीएच आहे तो काय होतो फॉल होतो and this leads to diuresis. So ammonium chloride it having nauseating taste and also it leads to or it causes gastric irritation. That's why it is rarely used as a diuretic. युरिया फॉर्म्युला काय आहे त्याचा कंपाऊंड अनालिसिस केला असेल.
NH2CO, NH2.
NH2CO, NH2.
Okay. मग तेच इथं सांगितलेलं आहे की when ammonium chloride is administered orally, then after their absorption, ammonia is converted by the liver to urea. मग युरियाचं काय फॉर्म्युला?
NH2CO, NH2.
म्हणजे त्याच्यामध्ये कन्वर्ट होतं NH4 अमोनिया. Then their preparations, ammonium chloride 8 to 12 gram is in divided dose daily. What is preparation?
Ammonium chloride 8 to 12 gram in divided dose daily.
Okay, the next point is uses. First one is congestive heart failure. Then second, essential hypertension, congestive heart failure. माहिती आहे? What is mean by CHF? काय होतं? Why it is happen? Sound is audible to all?
Yes, ma'am.
CHF. Why it happen? Because the function of heart, that is pumping of blood, is not done properly. Heart cannot pump the blood either in systole or in diastole. That's why congestive heart failure is occur. Is it right or wrong?
Right.
Yes, ma'am, right.
तुम्हाला कधी यायचं हे सिरियस झालंय? सिरियस झालंय की नाही? Drugs acting on cardiovascular system, cardiotonic, anti-anginal, anti-arrhythmic, anti-hypertensive, anti-hyperlipidemic agent. त्याच्यामध्ये अगोदर डिसऑर्डर घेतले असतील आणि आफ्टर दॅट हे झालं असेल. What happen in CHF in generally सांगता येत नाही. What is function of heart?
Pump of blood.
Pump in the blood.
Then second, essential hypertension. What is mean by hypertension?
Increase blood pressure.
Increase blood pressure.
Increase the blood pressure.
माहिती आहे सगळ्यांना? Yes or no?
Yes, ma'am.
Yes,
ma'am.
Okay, then next, hepatic cirrhosis with ascites. Hepatic cirrhosis means हेही सांगितलेलं आहे. Hepatic
liver failure.
related to which organ?
Liver.
Cirrhosis. Cirrhosis means hepatic cirrhosis means there is damage of liver with ascites. Ascites means there is pressure which is built up on the vein and that's why liver does not work. म्हणजे veins वरती pressure येतो with ascites म्हणजे there is pressures on the vein and that's why liver does not able to work and there is damage of liver is occur. So firstly आपण काय बघतोय पॉइंट कोणता बघतोय?
Therapeutic application.
पॉइंट कोणता बघतोय? थेरापेटिक
Therapeutic applications.
कोणत्या चॅप्टर मध्ये? चॅप्टर कोणतं सुरू आहे?
Diuretics.
डायुरेटिक्सचे ऍप्लिकेशन्स बघतोय आपण. फर्स्टली क्लासिफिकेशन 1 by 1 कव्हर केले. आफ्टर दॅट therapeutic applications or uses of diuretic. It is used to treat the following conditions or following disorders, in which first one is
Congestive heart failure.
second,
Essential
hypertension,
Essential hypertension.
Third,
hepatic
Hepatic
cirrhosis with
Hepatic
acid,
cirrhosis with acid.
fourth,
nephrotic
Nephrotic
syndrome,
Nephrotic
syndrome.
hormone syndrome.
okay, so nephrotic syndrome, it means nephrotic म्हणजे कोणते related असेल? It is
Kidney.
related to which organ? Nephron. It is structural and functional unit of kidney. That's why it is related to second year. लक्ष आहे का?
kidney,
Yes, ma'am.
kidney,
Yes, ma'am.
So nephrotic syndrome, it is a kidney disorder and which causes the body to excrete too much of protein in the urine. म्हणजे urine मध्ये major amount मध्ये proteins excrete होतात. That is nephrotic syndrome. Syndrome means what is mean by syndrome? हेही सांगितलंय. It is group of symptom. It is known as syndrome. Then chronic renal failure. Kidney failure माहितीये?
Yes,
Yes,
ma'am.
ma'am.
yes ma'am,
Then acute oliguric renal failure. That is oliguric means low urine output. So because of low urine output, there is renal failure occur. Then acute glomerular nephritis means there is inflammation to glomerular nephron. So that is acute glomerular nephritis. Then next, edema in pregnancy. What is mean by edema? Anti-gout agent, anti-rheumatism. कशामध्ये झालंय edema? There is deposition of fluid in between the joints. काही येत नाही. Edema, it is an swelling which is caused due to there is deposition or excessive fluid which is trapped into the body tissue or into the joint. That is edema. So this edema swelling, it occurs because of this deposition or excessive fluid during the pregnancy. Then cerebral edema. Cerebral means it is related to CNS or CVS.
CNS.
CNS.
Fluids remains in the brain. That is deposition of fluids into the brain. That is cerebral edema. Glaucoma means it is also covered in drugs acting on the eye. Mydriatic, miotic drugs used in glaucoma. Glaucoma, it is an eye disorder in which intraocular
Molecular pressure increase
होते.
होते.
Then next, intraocular surgery म्हणजे आयचे जे सर्जरी आहेत त्याच्यामध्ये यूज होते. Then next, it is also used in diabetes insipidus. It is type of diabetes mellitus, so in which these diuretics are used. Then next, salicylate barbiturate poisoning. म्हणजे ह्या poisoning मध्ये diuretics यूज केले जातात. These are the applications of diuretic. The next point, side effects of diuretic. Read the side effects.
Metabolic acidosis, hypokalemia, and dilution hypotrenamine.
Okay, metabolic acidosis. Acidosis means there is excessive acid condition in the body fluid. Alkalosis means alkali or base excessive level in the body fluids. Hypokalemia. Then dilutional hyponatremia. Hypokalemia means
Increase potassium level in body fluid.
increase.
Decrease, ma'am. Sorry.
Then dilutional Hyponatremia means hyponatremia means there is low level of sodium ion concentration in the body. So these are the side effects of diuretic. After the side effects, one point is remaining: contraindications of diuretic. So where it is contraindicated? So firstly, it is contraindicated into the diabetes patient which develop hyperglycemia. Then डायबिटीज पेशंट मध्ये कॉन्ट्राइंडिकेटेड केला जातो, बट ट्रीटमेंट मध्ये काय बघितले आपण? Anyways, in also it is contraindicated in liver cirrhosis because it produces electrolyte imbalance and which leads to hepatic coma. म्हणजे जर का ते hepatic cirrhosis मध्ये दिलं, liver cirrhosis मध्ये, तर ते काय करतंय? Hepatic coma. There is imbalance of electrolyte and which leads to hepatic coma. That's why it is contraindicated in liver cirrhosis. Then it is also contraindicated in patient which having the gout. ज्यांना gout disorder आहे, gout means uric acid ची level increase होते. So त्या patient मध्ये contraindicate केले जातात. So because of this, जर तसेच दिले आपण goutच्या patient मध्ये, then it leads to hyperuricemia. Then next and last contraindication, it is contraindicated in the patient having the lithium therapy. It should not be administered diuretic because they decrease the renal excretion and lithium causing intoxication. म्हणजे ज्यावेळेस लिथियमची थेरपी सुरू असते त्यांच्यामध्ये जर डायुरेटिक्स दिले तर हे डायुरेटिक्स काय करतात? दे डिक्रीजेस द रिनल एक्सक्रीशन ऑफ लिथियम. म्हणजे लिथियमचं एक्सक्रीशन होणार आहे, इट इज रिमूव्ह फ्रॉम द बॉडी. तर ते काय करतात? डिक्रीज करतात हे डायुरेटिक. मग आजच लिथियम बॉडीमध्ये राहिलं तर काय होतंय? इंटॉक्सिकेशन, टॉक्सिसिटी ऑकर होते लिथियमची. That's why it is contraindicated in lithium therapy, contraindicated in liver cirrhosis, also in diabetes patient and in gout. समजलेच contraindications?
Yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
Side effect?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, here we complete this unit, drugs acting on renal function or in which diuretic, with their definition, classification, preparation, mechanism of action, their site of action, side effects and therapeutic uses, and lastly contraindications. Okay, the contraindication मध्ये जरी तुम्हाला क्वेश्चन नसेल तसा पडला तरी इन जनरली सांगते, जे डायबिटीसच्या डिफरंट टाइप्स असतात त्याच्यामधलं फक्त डायबिटीस इनसिपिडस मध्ये डायुरेटिक्स दिले जातात. अदरवाइज इट इज contraindicated in diabetes patient. So here we complete this unit. Any doubt?
No, ma'am.
All of you understand this unit?
Yes, ma'am.
Yes, ma'am.
Ma'am.
Ma'am.